Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Coach Mike Vrabel, head coach of the Tennessee Titans. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I want to begin by taking a moment to recognize our neighbors in Chattanooga who suffered severe storm damage yesterday evening, and at least 20 individuals have been hospitalized there. 150 buildings have been damaged, and 60,000 residents are without power. Although these are preliminary numbers, we know some of how they feel. Our thoughts are with all Chattanoogans and everyone who's been touched by the storms that swept over the southeast over this weekend. Now, I want to thank everyone here in Nashville for faithfully observing the Safer at Home order over the holiday. As usual, we saw widespread compliance throughout Davidson County by both residents and businesses. Your efforts are helping flatten the curve of the coronavirus in our community and will save lives. Now remember, eradicating this disease requires a coordinated effort by all Nashvillians, and I urge everyone to continue to stay at home as much as possible and only leave your home to run errands that are essential to everything. Now, all of us have been touched by the coronavirus in one way or another, but it's important to understand exactly how the virus is affecting different members of our community, which is why epidemiologists with the Metro Public Health Department has been working diligently to contact residents and gather all available information and all available race and ethnicity data for confirmed cases in Davidson County. This valuable information will help us better understand the virus and the effects it has here in Davidson County, and Dr. Jahangir will present this information and discuss their findings in more detail shortly. I want to remind everyone that the community assessment system is available to everyone in Nashville free of charge. If you believe you have symptoms of COVID-19, please call the COVID-19 hotline at 615-862-7777. which is open 7 days a week from 7 a.m. to 7 p.m. If additional assessments are necessary, you may be directed to a community assessment center to be screened and tested for COVID-19. All services at Metro's community assessment centers, including COVID-19 tests, are also free to Nashville residents. And these community assessment centers are open at Nissan Stadium, Lot N, Meharry Medical College at 918 21st Avenue North, and the former Kmart site at 2491 Murfreesboro Pike in Antioch. Now, hours of operation for all three locations are from 9 a.m. to 3 p.m. Monday, Wednesday, and Friday until further notice. Now, I very much want to welcome Coach Mike Vrabel of our Tennessee Titans for joining us this morning to encourage all Nashvillians to stay the course and remind us about the importance of social distancing during this time. And I know I speak for many, many Nashvillians when I say that September can't come soon enough, and we're all looking forward to a fantastic season of Titans football. As always, I urge everyone to visit covid19.nashville.gov to make a contribution, as you are able, to the COVID-19 Response Fund, which has been created to provide relief to Nashvillians facing hardships during this time. You can also visit the COVID-19 website to find direct financial, mental health, food, and social service assistance through the COVID-19 Response Fund and through local community partners. And with that, I'll turn it over to Dr. Alex Jahangir, the chair of the Metro Coronavirus Task Force. Thank you very much.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on the coronavirus in Nashville and Davidson County. We have 1,385 confirmed cases with a total of 13 fatalities. That's an increase of 161 cases since Friday, but no additional deaths. There are an additional 1,410 cases in our surrounding counties, bringing our total in our region to nearly 2,800. Of the Davidson County cases, 1,081 are currently active, and 291 residents have fully recovered from the virus and have been cleared. This morning, we have the race numbers to share. Of the Davidson County confirmed cases in regard to race, 49% are white, 13% are black, 12% are multiracial or other, 3% are Asian, 8% unknown, and 15% are pending. We will continue to update the numbers as soon as we have them for you. This information is very important to us as we analyze and understand and how we plan for the continued battle of this virus. To strengthen this data, I have also asked information regarding race and ethnicity to be collected for anyone tested at our community assessment centers. The most medically vulnerable are the people this virus impacts the most. As is the case with this virus and many other medical conditions, the impact is disproportionate to minorities and those with limited access to health care. That's one reason we positioned the community assessment centers at the locations that we did. We wanted to ensure that people who don't have access to health care would have access to COVID assessments and tests. There's no cost at these centers for assessments, and if indicated, no cost for the tests. Here's what's important. If any Nashvilleian believes that they have the symptoms, fever, cough, shortness of breath, or new and unexplained loss of smell, please seek medical attention and get assessed, either with your local healthcare provider or through our community assessment system. You may have noticed that new and unexplained loss of smell is a symptom that I have not previously stated. As I have said from day one, the science will direct our response to this crisis. And over the past week, loss of smell has become recognized amongst medical professionals as a possible sign of this virus. As such, we want to make sure our community knows this, and we have adjusted our protocols to assess and, if indicated, test anyone who presents with any of the 4 symptoms. Our goal for our assessment centers is to ensure that our community has broad access to testing. This is a critical step to ensure victory against the virus. The first step is to call our assessment hotline at 615-862-7777. It's open 7 days a week from 7 a.m. to 7 p.m. You will speak with medical personnel who will answer questions and help determine if you need additional screening. Today, as the mayor noted, our community assessment centers are open until 3 p.m. at our 3 locations at Nissan Stadium, the old Kmart in Antioch, and at Meharry Medical College. So far, 1,776 people have been assessed in our centers and 1,120 have been tested. Finally, the Safer at Home order went into effect on March 23rd. No decision has been made yet on whether to extend the order or not. Vanderbilt released a model on Friday that shows that all of our efforts with Safer at Home and continued social distancing is truly flattening the curve. The study also showed that if we stop too soon, then the numbers of people who will be hospitalized will go up, and our health systems will be overrun, and more Nashvilleians will die. If we adhere to what we are doing, we will get through this successfully. Other models show different timing for the peak, but they show the same results regarding our progress. We continue to look at the various models, and this will help guide our decisions moving forward. We have not reached the peak of this virus yet, the point at which the most people are infected at a single moment in time. When we do reach the peak, we will still need time to come down on the backside of the curve before we can begin to get back to normal. And again, the models show that social distancing works and it's helping us flatten the curve. We need you to stay at home and remain vigilant to fight the virus while staying at home. It is an absolute necessity. I'm grateful for all of what you all are doing, and thank you for your support. We'll get through this together. And now I'm proud to introduce the coach of our Tennessee Titans, Coach Vrabel. Coach.
Good morning. Thank you, Doctor. On behalf of the Tennessee Titans organization, would like to thank Mayor Cooper for his service and his leadership. I would like to thank Dr. Jahangir for his medical guidance. I want to thank our community for staying positive, for helping one another. It's important now that we continue all our efforts. We'd also like to thank the men and women, our first responders, and those men and women that are in our medical fields that go to work every single day, whether they're tired or they don't feel well. They're the ones that are helping us, and they're going to be the ones that get us through this difficult time. We have to stay positive as a community. We have to follow the guidelines set by our leaders in the community that will help us get through this. We have to continue to support our local businesses and help them through this unique time. As in everything, especially with the Tennessee Titans football season last year, it's not necessarily how you start, but it's how you finish. We can't allow all our great efforts as a community and leadership to stop because we're halfway home or we're close to halftime. We have to make sure that we have the resolve to stay positive, to follow the guidelines, to finish, and have the resolve to see this thing through. Help one another. Help your neighbor. Help those people that are less fortunate. Spend more time worrying about somebody else than you do yourself. Because I can promise you that there's a lot of people that have it worse off than what you or I do. Again, I would like to thank everyone, thank the mayor for his guidance and leadership, and Doctor for his remarks.
Thank you, Coach Vrabel. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Tosin Fakile at News 4. Tosin.
Good morning. Thank you for taking my question. I have two questions. The first is the governor's safer at home order expires tomorrow. Do you guys have any concerns at all about that expiring tomorrow in conflict with the mayors, and just any concerns at all about the time difference between the mayors and the governors? And my second question is, did we by any chance have any violations or calls about the safer at home order during Easter yesterday? And if so, how many?
Thanks. Dr. Jahangir.
Sure. So what I can tell you is as the Vanderbilt study and other models have shown, is what our safer at home order and everything that we have done as a community has really helped flatten that curve. And I can just speak to the science, and that's what the science has shown, and I'm proud that we're continuing that. And there were 0 citations or complaints actually just over the past weekend. So thank you.
Julia Palazzo. Go ahead, Julia.
Thank you so much. Just wanted to address, I remember Vanderbilt said, we're lacking widespread testing, and I know that is critical in all of this. I was just wondering if you guys had a plan to increase that, and also if there's an update from the task force that's helping small businesses. You have the number of businesses that have applied and the amount of money that's been given so far. Thank you.
Could you repeat the second part of your question again, Julia?
I'm sorry, which part?
The second part of your question?
The second? Okay. Just wanted an update on the task force that's helping small businesses. If you have a number of businesses that have applied and have reached out.
Okay. Dr. Jahangir is going to answer the first part of your question. Thank you.
Sure. So regarding testing, I think over 16,000 tests have been conducted in Nashville thus far. I know, as I've mentioned before, many places are conducting tests around the community of all of our health systems, which I know have sped up their ability to do testing. As I mentioned in my remarks, our community assessment centers, we are now loosening and broadening who is tested in our centers, and we'll continue to do that because you're right, a broad access to testing is a critical step in winning this battle against this virus. Regarding your second question, I don't have that information right now. We'll be glad to follow up on and get that to you. So thank you.
Julia, I will follow up with you by email on your task force question. Nancy Amons.
Good morning. Thank you. I have a question for the mayor. In light of the Vanderbilt study, has he considered expanding this stay at home? I know he was concerned about home improvement projects. Has he considered expanding it at all?
Mayor Cooper.
Thank you, Nancy. I guess in terms of expanding, this, or you're talking about lengthening the safer at home order, and in that case in Nashville, we're going to take it 1 and 2 weeks at a time. Right now, we are making progress. The number of cases does seem to show that the curve is flattening, and we just want to continue on with that. And we hope that the state follows suit, of course, and that we have a coordinated state effort to flatten the curve.
Nayeli at 96.7.
Yes, I have actually two questions. One of them, I wanted to know what does the community do? Where can they ask for help when organizations say that they no longer have funds for those who are in need? For instance, some organizations say they only have funds for about 90 people, 40 people. What happens when they tap out with their funds that they have given the organization federal funds? My other question is, what are you guys doing to help those who are self-employed who do not qualify for unemployment?
Okay, so the first question is about nonprofits.
Yes, the nonprofits where the funds are going to help those who are in financial need.
Okay.
What happens when they tap out with the funds that they have?
Okay. Mayor Cooper.
Thank you. I'd ask him to be in contact with my office. There are different sources of money that is available, including our own COVID-19 fund that's in partnership with the United Way. So all the nonprofits that are doing such worthy work in the community, we understand that you've never been more needed or more useful. Let's work with you to try to find additional sources of money. And then for the self-employed, boy, that is such a hardship for so many people in Nashville. We just need to flatten the curve and get back to work as soon as possible. That's the first way of really helping them. And then all of us who can, let's patronize our restaurants who are doing curbside service, and then continue to help where we can support everybody that's working and can work, who is essential and can work in our community. Thank you.
Ian Jong at the Tennessean. Ian?
Hey, good morning. I have a few questions just regarding testing. Dr. Jahangir had said that you guys have started to widen the scope of that. I was curious on when that started happening, and if you can explain what that means and looks like for who we're testing. And one, just curious about asymptomatic cases, whether that's been tested before and how many of those make up the cases we have so far. And as a last question, sorry, can you give us an update on how much testing we have, or if we're low on test kits in the city?
Ian, did you say asymptomatic testing?
Yes.
Okay. Dr. Jahangir?
So good morning. So regarding your question around expanding, I can speak to both our community assessment centers and what our community partners and the other health systems have done. As the symptoms, from day one, I've mentioned shortness of breath, fever, and dry cough have been kind of the signs for anyone to get assessed and get tested. Now the science is showing that loss of the ability to smell, a new loss of ability to smell, they don't have any other reason, is another reason to get tested. Also, similar to our community partners and other health systems, initially testing was being performed when people had those symptoms, plus met certain other medical comorbidities. Now, as the entire community is looking to expand testing to people who meet certain requirements, broaden the testing for more in our community, the general consensus in the medical community is the 4 symptoms I described, and testing anyone that has those 4 symptoms. So I believe most of our community partners are doing that, and our assessment centers were doing that as well. So testing asymptomatic people right now is not what is standard of care in our community, and we're not doing that to my knowledge, at least in the circles I'm in. And then, as I've mentioned, about 15,000 Nashvillians have been tested already, and about a 9.5% positive rate for that. So I think that's consistent across all the places that are being testing, which to me demonstrates that we're consistently applying the same standards to testing, and that's pretty reasonable. So thank you so much.
Harriet Wallace, Fox 17. Harriet?
Yes, hi, good morning. First, I want to say thank you so much, Dr. Jahanger, for updating us on the data collection, and it's much appreciated. My question is regarding the Safer at Home order. Once the statewide order expires, at that point, obviously, it'll be left up to the individual mayors to make the decision for their own municipalities. Mayor Cooper, can you please, I believe you touched on a little bit, have there been discussions amongst mayors in terms of how you will govern in coordination, because that will likely encourage people to travel county to county, and in Davidson County, where we have extremely high numbers compared to the counties, that could maybe hinder some of the progress that we've made. So what discussions have you had or will you have with other mayors?
Harriet. Mayor Cooper?
Well, thank you, Harriet. I think public policy in the time of a pandemic is a little bit of evolving. Tennessee, has 95 counties, a whole lot of cities, and I think all of the mayors that I've talked to feel that consistency and a unified response is effective. That's not only in our region, but across the state, other states too, if possible. But we are, as all the mayors that I've talked to, everybody, I think with very, essentially no exceptions, feels that a consistent response and that we're still in the middle of it. We're still flattening the curve, and it's going to be important. Nashville is in a region, the region has as many cases as Nashville does. So that shows that it is a regional problem here. And then also in the state, I think we're better than a lot of states have been. If you look at some of our neighbors to the north, boy, that's pretty shocking, but we want to stay on the good side of that. And again, have a consistent response that no one is putting each other at risk. No one is putting each other at risk unintentionally. And then a unified, consistent response is the best. And I think all the big cities in the state have adopted the same safer at home that Nashville has been under. And I think we all recognize that that's going to have to continue for a while to be effective. Thank you.
There are no more media questions in the queue at this time. Again, special thanks to Mike Vrabel, head coach of the Tennessee Titans, for joining us this morning. A recording of this morning's press briefing will be made available later today. Thank you for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.